This is something that the medical profession does not acknowledge. They do not say actually really exists, but we all know it is true. And that is adrenal stress or adrenal fatigue. And I'm going to talk you through how I have a conversation with patients about this right here, which is important and impacts so many patients when they come in and they have fatigue, energy issues, foggy thinking, they've got joint pain, maybe hormone problems, any number of different symptoms, GI related disorders. It's almost always, if you have a high stress kind of situation in your body, it only makes sense that your stress centers or your adrenal system may be actually taxed. So let's discuss that here right now today. So, adrenal stress or adrenal fatigue, we are talking about what your adrenal glands do. And your adrenal glands, they actually produce cortisol, um, for starters. And so, your adrenal stress hormones, they actually help you to actually deal with stress in the body. So, what do you use and when do you actually create cortisol in the body? Well, anytime that you do have an emotional upset, maybe some type of a hard time at work or with a spouse or with friends or whatever, you're going to utilize that stress hormone cortisol. What's also going to happen, also, if you have any infections or maybe even toxicities or maybe even deficiency areas, any number of stresses can be emotional because when you think about somebody says, well, I'm having some kind of stress today, they think about the emotional things, right? But the reality of it is that any physical stress that we encounter is also a stress on the system. Even a fall. I mean, I've seen patients that have actually they've had a physical fall and it has affected their immune system and it actually kind of aggravated and turned on a rheumatoid arthritis flare because of a fall. It increased all the different inflammatory markers in their body because of that stress event. Also, because of the different stresses that go on here, yes, it could be physical assault or a fall and kind of traumatic event there, but also any of these stresses I'm just talking about. Didn't even say allergies. That could be another stress event. Those can also affect your GI tract, right? Of course, that can affect that. So many times, your stress hormones can also affect your heart and also blood pressure kind of involvement. We know that your cortisol has an effect on the entire body, and so 100% these stress events that you have on a regular basis can sort of deplete your reserves, your ability to maintain multiple different systems throughout the body. I'm only hitting a few here today. Now, a major one is also your sex hormones. Of course, that would be like your estrogen and also testosterone and other hormones. But all of your sex hormones are cholesterol derived hormones. There's much more of an intimate connection between your cortisol levels and your sex hormones. And the reason why is because they're all cholesterol derived. They all come from cholesterol. And it is a big shell game that occurs with inside the body and you're trying to make what you need to make. But when you have a lot of stresses on the system, I could also throw in genetics in here, just another potential stress. When you have these different stresses on your body, it can affect how your sex hormones are actually produced. And so you may have somebody who has multiple different stress events going on throughout the day, emotional and physical, and that might alter their testosterone levels or estrogen levels, how they actually convert some of their fractions of estrogens into another. Another very important connection is its effect on thyroid, right? 100%. You can have an effect of cortisol on your thyroid production. And your thyroid is a very important hormone that affects your metabolism. And those that have chronic stress will often have an elevated amount of reverse T3. And those that do have chronic stress events, and they also have some elevated reverse T3, they may be stuck because of this in metabolic syndrome. Think of it this way: if you are on an island starving to death, your body is going to try and slow down your metabolism on purpose and create more reverse T3, which is a metabolically defunct thyroid hormone, to try and slow down your metabolism on purpose to help you conserve your resources for a rainy day. And so oftentimes with chronic adrenal stress, you can have high amounts of reverse T3 and you are stuck in metabolic syndrome. And if you're stuck in metabolic syndrome and your reverse T3 is high, most commonly your TSH, remember those numbers you have tested on health fairs, your TSH and T4, they will often be normal, but you may still be stuck in metabolic syndrome. So this is the point. When people come in and say, I want to know if I have adrenal fatigue, I go to my physician and I ask them, do I have this? And they say they don't know. And then they don't test for any of it. And the reason why is because from a medical standpoint, testing adrenal fatigue is nothing that they acknowledge. They don't acknowledge it. There's no classic diagnosis for adrenal fatigue, because this is a holistic understanding of what occurs in the body. One thing affects another, right? Your cortisol levels can affect every part of your body. And so the classic understanding, okay, if you've got something wrong with your thyroid, we give you thyroid medication. If you've got something wrong with your sex hormones, we give you testosterone. If you've got something wrong with your blood pressure, we're going to give you blood pressure medication. You have something wrong with your immune system, we'll give you some immune modulating medication. But they don't address the root causes right there. So this can be multifactorial. It's not something that's easy as one and done. Sometimes you do have to do some investigation. Now, obviously, you want to be making sure you get plenty of sleep, because you betcha lack of sleep can affect that, can affect your adrenal stress, because you have to be able to rest. You have to be able to rest and digest, right? And so if you're not getting proper sleep, that'll affect it. Some of these things in here you cannot affect, right? You can't necessarily get rid of a emotional problem at work all the time. Sometimes, and of course, you have to work. But some of the things on here you can, right? You can address deficiency areas. You can address allergy issues to a certain extent. You can address your immune system. You can address toxicity issues. You can address those things. Sometimes you don't know what these things are, right? Because you've been doing the same thing for many years and things have just been getting worse and worse and worse. As we age, our weaknesses become more apparent. So sometimes you have to go looking. I had a gentleman came in and he had low testosterone. He had male issues, he had joint pain. We tested, sure enough, he had low T. And so the common theme is, hey, why don't we go take some testosterone? Isn't that a good idea? Well, some people might need a hormone, but if you take testosterone, that doesn't mean you fix the problem. There's something still possibly going on in here. And it's time to get to the root cause. Same thing with the lady. If you've got a lot of fluctuations in your hormones and you're having hot flashes, well, just taking progesterone, just taking estrogen doesn't necessarily fix your problem. Maybe it's a good thing to do, maybe not. But at least you should test and try to find the actual cause of the problem and not just throw something at it, at whatever, and see whatever sticks. You need to get to the root cause of the problem. From a medical management standpoint, adrenal fatigue doesn't exist. From a holistic understanding, all of the things in the periphery here, everything here is affected by the level of stress on your body. That's why it's important to do the proper testing. And that's what we do. We do a comprehensive nutrition evaluation to get the root cause of the problem, and we don't just look at just a wellness panel. That's the problem. That's a problem. Going to my next topic here, which is this. You have seen probably similar panels like this, a wellness panel from a health fair. And what are they doing? They're looking at maybe T4, they're looking at maybe your cholesterol, and maybe a metabolic panel. And that may be about it. Unfortunately, those who, when you're just going to a healthcare or health fair, they are only looking at a very small amount of parameters, trying to make sure that your cholesterol is okay, because that's their protocol, trying to make sure that your white blood cell count, that you don't have some kind of active infection, and making sure your liver and kidneys are functioning correctly. And maybe screening for diabetes, maybe. But when people come in and they have fatigue and they have energy problems, they have joint pain, and they've got maybe they've got skin and dermatitis issues, and maybe they've got concerns about actually Alzheimer's, or maybe even more serious concerns. Perhaps they have rheumatoid arthritis, or they've got a chronic debilitating problem and nobody's addressing it. And every time they go in, they have this done, which is absolutely ridiculous when that's all they're having done. Oftentimes, and that's why I have patients that come in. That's the reason why they come in, is they say, I keep going in and they keep doing the same thing. They never do anything else. You need to get to the root cause, and the cookie cutter approach that's out there, that's only looking at those few parameters and not actually doing an actual extensive test to see, well, then you're guessing. Because not to test, it is to guess. But to test is to know. We have people that bring in a bag full of supplements. They've been having this done on a regular basis. And they come up with a bag full of supplements. And I ask them, why are you taking all these? And they say, well, I heard it was good for me. I said, well, maybe it is, maybe it isn't. But this right here is not enough. You need to get to the root cause and find out, maybe you don't even need half of what you're taking. Maybe you need to take more. Maybe you need to do something completely different. When we are doing a comprehensive nutrition evaluation panel, we are doing nutrition by the numbers. We are also looking perhaps at gut dysbiosis, also different types of allergies and sensitivities for foods and things like that at times, toxicity testing, chelation at times as well, autoimmune testing, viral testing. There's lots of different things, lots of these different stress events right here that can cause patients problems. And this type of testing right here does not address all those issues. So if you're concerned about having adrenal fatigue, you can't just rely on just looking at that. That just doesn't do it. You've got to get to the root cause, and the root cause may take a little more investigation, a little bit more time, but know this: your body is designed and created to heal and repair and self-regulate. When you give the body what it needs, and when you take away what it doesn't need, the body's able to heal, repair, and self-regulate. And that's why I could show you multiple examples. The gentleman I talked about, low T, he didn't take any testosterone whatsoever. We just dealt with these things right here. He had a vitamin D deficiency. He did have a little bit of a thyroid problem. He also had a couple foods that he needed to eliminate. He also had a minor kind of infection kind of issue. We dealt with those things. He came back several months later, and guess what? His testosterone came up 100 points. His energy improved. His blood sugar and those numbers improved, all without any kind of medication whatsoever. Nobody's deficient in Tylenol. Nobody's deficient in any synthetic medication. And many people who are taking testosterone or other hormones are not deficient in them either. Maybe they are, but if you are not testing, you are guessing. So get to the root cause and contact us, because we have a root cause nutrition evaluation panel that we are doing that is getting the root cause, getting amazing results for patients, and getting the root cause of problems. I'm Dr. Murray with Murray Natural Integrated Health. Try to find one thing today to get yourself healthier than you were the day before, and then each day try to get 1% better, one thing better each day, and you will be amazed at what your body can do. Have a blessed day.